entertain it. So I'll be there for sure. Don't worry. I may say bam 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 bam. It's not an easy road. How many see the glamour and the glitter, so them think I better rose. Me say, who feels it knows? Woo, Lord, every sun say these blows. I cry, it's not an easy road. How many see the glamour and the glitter, so them think I better rose. Me say, who feels it knows? Woo, Lord, every sustain. Why? From the minute of birth, you enter this earth. Obstacle there in your way to overcome first. Throughout every day, they seem to get worse. Oh my God, cast away this curse. Everybody are trying to make every end meet you anyway. Now them head never like God, you see. No matter what the world may say, out of straight. Most of this up, I won't accept defeat. Now I'm weary, tired, dreary. Got no time to waste. You better know that it's not an easy road. How many see the glamour and the glitter, so
All
they
right,
think
getting
I
set,
better
getting set.
rose. Me say, who feels it knows. Lord, help
Joining.
with
Hey,
sustain these
Shauna.
blows. I
Greetings,
cry, it's
greetings.
not an easy road. How many
Is
see
the
the
audience
glamour
coming
and the
through loud
glitter,
and
so
clear? Let
they
me know.
think I better rose. Me say, who feels it knows? Lord, help with sustain these blows. Mind your eyes to see the sun. Who you love and who you don't. Trying to discredit the works you have done. Some not satisfied with the boast of ally. From the scribes and Pharisees, you got to stay wide. Hold up the head, dancing on both sides. How we anticipate, pray for your style. Righteousness prevail. It's down by my side. Leave my shoulder from the way. You live him to die. Help us all. Ababa Janai. Hold up my head and cry. I let you know it's not an easy road. Oh no, it's not an easy road. I did tell you it's not an easy road. Oh no, it's not an easy road. Why? I've been traveling morning with such an heavy load. Now it's noon and I cannot afford to put down my hurt alongside the road. Oh, I've got to hold it. Yeah, I've got to
Yeah, well,
humble
Clarence.
myself
Big up, big
like
up.
a child. Up on my face, I've got to put up a smile. I make up my mind just to have more mile. Oh God, I've got to, because I know that it's not an easy road. I mean, it's the glamour and the glitter, so they think I better rose. Me say, who feels it knows? Lord, help we sustain these blows. What's more, it's not an easy road. I mean, it's the glamour and the glitter, so they think I better rose. Me say, who feels it knows? Lord, help we
We're
sustain.
getting set.
Why, from the minute of birth to enter this
Greetings,
world,
greetings as you
obstacle
join.
in your way to overcome first. Throughout every day, they seem to get worse. Oh my God, cast away this curse. Everybody are
All
trying.
right, all right, all right, all right. All right, welcome to Wataguan. Welcome to Wataguan. Greetings, greetings, greetings. My name is Donovan Simon. I'm the president for the Jamaican Canadian Association Alberta. And Wataguan is our way of connecting to the community, talking about things that are happening in our association, talking about things happening in our city, talking things happening in Canada, in Jamaica, all over the world. And for June, we have been talking about health issues. And today, we want to continue that discussion, looking at some things that affect our women, right? And I'm hoping to have Dr. Unati on the show talking about fibroids and a number of other things that affect Black women in particular. But before we do that, we have to always do some features of what are going on, right? One of which is the Patwa word or the Patwa phrase of the day. And today, the Patwa phrase, kind of working through this one, is Tansobak. Tan so back. And hopefully the people on the show, whether you're watching it live or recorded, can add some explanation in the comment section. If you were in Jamaica and you want to talk about use it in a sentence, somebody would say, boy, I'm just this, or I'm just there, so a tan so back, right? So let's see if anybody can explain what it means for those who don't understand the Jamaican patois. Of course, we want to talk about things that are coming up, right? We've got a general meeting tomorrow, right? It starts at 7 o'clock. It's going to be on Zoom because things don't totally open up yet. So we're going to be doing it on Zoom. And it's the link would have been in our newsletter, but if not, check our website or check our social media and you can jump in and learn what's happening. We've got a couple of great bits of information to share in our general meeting. It's open to the public, so feel free to come on in and learn what's happening with our association. On July 10th, we've got two big things coming up. The first one is what we call Little Taste Benefit, food, right? We're going to have a showcase. Well, it's a little bit more than a showcase because it's real thing you're going to get to eat, right? Where you can pre-order Jamaican, real Jamaican food, right? Support a cause, right? The proceeds from the Little Taste Benefit is going towards our scholarship fund or benevolent fund and our backpack program. You can get some fish, some ackee and saltfish, some jerk chicken, some ital stew, right? And also there is delivery options. So we deliver within Calgary, Airdrie, and Chestermere. So jump on our website, jcalberta.com, get more information, but more importantly, order. Put your orders in by the 7th of July so that we can plan and get our deliveries and everything running nice and smooth. Uh, Following that, we're having a separate event called our 2021 Virtual Cultural Showcase. It's going to start at 6 p.m. So after you have skipped the kitchen, you're going to jump online. We're going to be streaming live on our Facebook page or YouTube channel and also on our website. Lots of artists just there to share our culture, poetry, DJs, singers, all kinds, gospel, you name it. And we're going to be streaming live starting at 6 p.m. So after you skip the kitchen through the Little Taste, then you're going to jump online and enjoy the cultural showcase. So make sure that you jump on our website and get all the additional information. There's still a couple of days to go before applications close for JCA scholarships. So jump on our website on the scholarship page. You'll see what the requirements are. There are a number of scholarships that we're planning on giving out this year. So if you are in a tertiary institution or going into a tertiary institution, you're going to be eligible to get a scholarship. We continue to ask for your support through our Helping Hands program. Now that the restrictions are being lifted July 1, we'll be able to do a little bit more and get an official launch and all of those things for our building. But our Helping Hands program is there asking you to join in supporting what we're doing. You can get your hands or decal logo, etc., on a 16 by 14 foot wall. You can get on our website. You can have a social media feature on you. You can get featured on Wataguan. We're going to get that wall up and running, and hopefully in another week or two, I'll show you the first round of hands that are up on that wall. Of course, if you've watched Wataguan at any time, you know this one is one of my favorites. The library. We've got a resource room, which includes a library, and we just keep asking for donations of books from Jamaican and Afro-Caribbean writers, for young readers, for adults, etc. It doesn't matter. We want to build the single largest collection of Jamaican and Afro-Caribbean books in Canada. Yes, I keep saying it's an ambitious goal, but that's the plan. You want to have the single largest collection of these books anywhere in Canada. So help us out. Donate some books. If you're an author, even better, donate one of the books to the cause, right? And if you've got some books that you've possibly not looked at for a while from Jamaican and Afro-Caribbean authors, please get in touch with us. We'll make arrangements to come collect them, or you can drop them off at our building. If you want to get in touch with us, there are a number of different ways. You can jump on the website, jcalberta.com. You can send us an email. You can make a phone call. You can link with us on our social media platforms. There are a range of different ways to talk to us and to connect and for us to share ideas. And if you've got some stuff that you want to donate, or if you want some information about the liquor taste or about the cultural showcase, or who knows, maybe you just want to know what the patois word of the day means. Either way, jump on any of these options and talk to us. For those who are joining late, patois word of the day is tanzabak, right? It's like all the place hot. Some people just, like what I say in Jamaica, it just jukes and tanzabak. Right? So let's see how many people understand what that means. Share it in the comment section. I'm looking out to see who put anything in the comments, right? Like I said, for June, we've been talking about health issues, right? We talked about cancer, we talk about diabetes, we talk about natural options. And today we're going to talk about some stuff that affect women in particular. I don't know why, but this doctor is going to help us understand some of it. I'm going to talk about fibroids and some of the other things that affect our Black women. Now, it's interesting, when I was doing some research, as always, to prepare for the program, that fibroids affect Black women almost 3 times more than they affect Caucasian women, right? They affect women about 50%, 60, I think 50 to 60% of women will have some of these issues somewhere in their reproductive, or I should I say highly reproductive phase of their lives, right? And to affect people at early ages as well, teenagers, who knows? And there are a number of ways that affects. There are a number of ways to treat it, and we'll touch on that a little bit, because sometimes people don't understand what is happening and they jump to certain conclusions. And we'll talk about a couple other things. We're going to talk about the vagina. So for all the people who are sitting there saying, okay, what are you going to discuss about the vagina? We're going to bring Dr. Unati on, because there are a number of things that we want to touch on. Dr. Unati, how are you? No, you're on mute. It's 2021. I tell everybody no.
How are you, John? I'm good. How are you?
I am good. I am good. How have you been doing? Boy, I see you're busy like crazy. I saw, what was that thing on your t-shirt last week?
Flossom. You know I'm Flossom, right?
Yeah. You're just flossing, eh?
Yes, an individual who embraces her flaws or his flaws and
Yeah.
is still
All
awesome.
right. Absolutely flawsome. Love it.
Yes,
Well, welcome to Watagwan. You've been here before, you know it goes. You've been all around sharing information. I know typically, and for those who don't know Dr. Unati, typically Dr. Unati is out there sharing information about male health. Love it, because not a lot of people focus on it. But today we're going to talk a little bit about our women. We talk about fibroids and a number of the other things. And maybe to start the conversation, help us to understand what are fibroids, and what is it that makes them so prevalent in our Black women?
yes. Thank you so much, Don. And you know what? Thank you for actually doing this. And it's amazing, as a man, you still chose to do this. Kudos. Things are changing in the world. I'm proud of you. So basically, fibroids are non cancerous lesions, or maybe muscular like lesions that grow inside a female's womb. And I'm specifically mentioning non cancerous because sometimes people, when they get this diagnosis, there's a lot of fear, there's a lot of tears. People, they think it's the end of the world. They are non cancerous, they will not develop into cancer. And like you said, they are very common in Black women. We don't know why. Black women, they are affected 4 times more than the other races. And interestingly, yes, in the childbearing age, we see this in younger women. And some women don't even know that they have fibroids. Some women, they don't even know. It's usually by incidental finding. It's either I'm examining for something else in your abdomen, maybe you were complaining of maybe an abdominal pain that is not even related to the fibroids, because sometimes they don't even cause pain, Don.
Mm.
So it's usually, a lot of times, we catch these fibroids or these masses. They are kind of like, they look like masses basically. We catch them by incidental situations. I'm examining your pelvis or your abdomen, or maybe you were going for an ultrasound. I sent you for an ultrasound. Maybe you are pregnant, And then we see these. So a lot of times women don't even know they have, more especially when they are small. They could be as small as your eye, they could be as big as actually your head. Sometimes we've seen people when they have fibroids to be as large as a pregnant woman.
Right.
That could actually bring a lot of psychosocial issues. We're going to talk about that when that
Right.
happens. Yeah.
So let's go back a little bit because, like you said, sometimes there are symptoms and sometimes there are not.
Yeah.
But when there are symptoms, what are some of those that are likely to be showing up?
Right. So, like I said, depending on the size, if maybe you have, and you know what, actually, sometimes even the small ones, they could present with heavy bleeding. Normally women or girls have their period for probably up to 7 days. You notice that your period is longer than that. Or just between your period, you've had your period already, suddenly you get another intermenstrual bleed. That could also be an indication that there could be something, or you are constipated. Like I said, they could be as big as your head. So that could actually compress your bowel, and then you feel constipated. Lots of times we see women coming in because they feel the constipation, or sometimes the pelvic pressure. They feel there's something heavy in their pelvis. They feel like, doc, I have this heavy feeling down there. Or some people, when it's really bad and they are bleeding severely down, they could actually present with anemia. They have fainty spells, even faint because of they are losing blood.
Yeah.
Those are usually the commonest. Or maybe the abdominal distension. Like I said, people start asking, "Are you pregnant?" That's when people they get uncomfortable. Actually, I remember one time when I was practicing in South Africa, I had a patient who didn't even know she had a fibroid. We use weeks when we size pregnancy. So like she had like 16 week size, like 4 months pregnancy size of uterus. So these could actually have that psychosocial aspect where people could start asking questions. And sometimes you are aware, and I want us to emphasize this. Sometimes our black women, they are scared to come forward because of this, because there's a lot of stigma around. They
Right.
hide it, and they probably thinking it's gonna be the end of their relationship or their marriage. So it can bring a lot of psychosocial issues and stress.
Yeah. Because one of the things I saw in the research was that our black women tend to find out about 25% later
Yeah.
than other races that they have fibroids and therefore the treatment and stuff starts later. Is that part of that whole psychosocial uh, variable that we're talking about?
Absolutely, Don. And you know what? I mean, it happens. Even people, they've moved to Canada, there's free health. People still have that mindset that I don't want to go to a doctor. I'm not sick,
Right.
right? So usually it's the late diagnosis because it takes time to grow these messes. So a lot of times it's people who are not screening, generally who don't go to a doctor because they feel they are well. So
Right.
that's usually one component. Or secondly, they have felt they saw that mess I was talking about, they just scared, they hide. It actually even affects intimacy. They start avoiding intimacy with their partners because your partner, your spouse could start feeling, what is this bond in your tummy? So there's a lot of that which could even now bring other psychosocial issues in your relationship or
Right.
your marriage. So there's that component. Honestly, lots of times women, they just not screening, they are not coming, and they just don't know. Sometimes people, they don't know they have MS. Sometimes it has something to do with, if you're already a heavy person, like say you have maybe struggles with obesity, you don't know you have MS there,
Right.
right? So you don't know. So till you screen, till we emphasize screening in our black women,
Right.
doing all those pap smears, coming for the physical examinations, because we do examination of your pelvis and your abdomen.
Well, you know what, since we're talking about screening, because one of the things that come up in all these discussions is the need to be aware and the need to constantly, understand where the screening process comes in, whether it's diabetes, cancer. Here we go now with fibroids. And maybe let's segue into this whole question of vaginal health,
Yeah.
right? Because again, it's part of this whole process that affects our reproductive system. And I'll come back to treatment planning in a little bit, right? But let's talk a little bit about this because how are our people seeing this whole issue of vaginal health? Or are our women seeing it?
Yes. I love that question. It's my favorite. Actually, you know what? I think 2 months ago, I did actually a full show on vaginal discharge. I
Yeah.
wanted to talk about that because I've seen a lot of women talking about how they busy cleaning their vagina. They want it to smell a different way. And I want our viewers here, Don, to know this. Our vaginas have their normal health. They don't need any spicing. They don't need any perfumes. They don't need any of that because naturally, down there, we grow bacteria, which helps with the vaginal health actually. So there's a normal vaginal bacteria that grows there. It's normal. It has its own unique smell. And that's why you don't need to have any orange or pineapple smell. You don't need all of that.
Well,
I've seen
it
people
depends. It
success.
depends. Hold on. It depends on the circumstances.
I'm gonna get to that, Don. I'm gonna get to that. So what I'm saying is the key thing is vagina has its normal unique smell and it doesn't need any cleaning. I've seen people coming back to us saying, I douche. That's another key thing that a lot of black women I see doing. They say, I'm douching, doc. I want to make sure I smell good. And unfortunately, that douching could shift the normal vaginal health there, the bacteria that occurs naturally. And then that's when the problems come in. So we're going to talk about that now. Now, when you said, oh, that depends, of course, it depends. Now, when there's a shift in that vaginal health or vaginal bacteria, something called bacterial vaginosis could occur. This is now a shift where a woman starts experiencing itchiness or fishy smell, gray discharge, because now there's a shift in that normal flora that is normally occurring. And what could cause this? Douching. Like I said, women start putting things in there. They start putting all the fluids, saying they are cleaning. So douching could cause it, Dawn. Or now it's gonna be summer here. We go out and sit in the lakes and all that stuff. So sometimes because of the water treatment,
Hmm.
that could shift, the pH down in your vagina.
Right.
And or maybe a change of a new partner. Semen could change the environment down there.
Right.
So that could cause that shift. And of course, there's abnormal one. I do want to talk about that one.
Yeah.
Yes, the normal one is the normal whitish clear discharge. It occurs normally because you are in your reproductive cycle, like menstrual cycle, you are ovulating, you could have a normal clear discharge, or you are pregnant, we could see that whitish creamy, whitish clear discharge, or after your period, you could have that. Sometimes it could be brownish after your period because of the blood, right? That you are finishing. And then there's an ugly one that I want to talk about. It's when you have a sexual transmitted infection, the sexually transmitted infection, which it could be green, like green or yellowish. And it smells, and of course, it causes a lot of itching. That one, that's the one that I have a problem with. And then, of course, like I said, sometimes, and interestingly, women sometimes get into trouble with their spouses or their partners. It could be your spouse, your man, having infected you. But here's the thing, Don. Women, we have short urethras. Urethra is that little tube that carries our urine out,
Right.
right, to the outside. It's very short. And men, theirs is longer because of course it goes with the size of your penis. So now it takes long time for men to show symptoms. So your man could infect you with infection and not show any symptoms. And then you show symptoms, someone starts saying you cheated on him because you showed symptoms first. So that yellow and the greenish discharge is something that we watch lots. And of course, there's also another discharge, trichomonas, which is also a sexually transmitted infection, which could also have that greenish discharge. And of course, I want to come and talk about this one, Don, the pinkish or the blood stained one. That one is a very big flag. There could be something different. There could be cervical cancer you are dealing with. There could also be uterine cancer if you're a postmenopausal woman. So, colors of discharge, we need to be very careful on how they look like. And there's a cheesy one, which is usually yeast infection. We see this a lot after maybe using an antibiotic. We see yeast infection, or maybe you are diabetic. Diabetics, they tend to have that yeast. So there's lots of types of, honestly, discharge. You just need to know which one is healthy, and if you're not sure, just to see a doctor and can see. And we always take swabs too.
Yeah. So let's talk about one the social our response to some of these? Because you talking about this, there's some people who are possibly experiencing stuff, right, which they think, is caused by one thing or the other, and with that comes stigma, and they try to treat it on their own, or they delay the treatment. Is that something that happens, and how do you respond to that?
Very common, Don. Very common in our women. And even when the time comes, they have this, they have, okay, now they've talked themselves that or maybe things are getting worse, right? And then they come in. And I've seen people sometimes even refusing to do a pap smear. Like I said, what if it's a blood stained discharge? And I'm worried about cervical cancer. And I ask you, when was the last time you did a pap smear? And by the way, pap smear, we start screening at the age of 25. We used to say 21, but now Canada has changed to 25. So you do this every 3 years, and of course, depending on your results, according to your doctor's basically recommendations. So that's usually the case. Some people they delay coming in because of fear, and sometimes there's a fear of what if this is going to affect my fertility, what if my partner leaves me, what if the stigma around it, what if there's a lot of stigma around this. So the key thing is, women, if you see any abnormal discharge, you itchy, it's just an uncomfortable feeling and it's something new, just go see a doctor. Simple swab could just answer all the questions within a period of 3 to 5 days.
Yeah. So let's talk about the treatment planning around all of this then. Let's go back to fibroids a little bit. There are a number of ways based on, what I've read to treat fibroids. Some could be drugs, some could be, simple surgery, some could be major surgery. Talk us through some of these treatment plans.
Right, yes. Like we said in the beginning, Don, it depends on the size. I mean, if it's a little teeny thing, like a loony, we leave it alone and just keep an eye on it. But here's the thing, fibroids depend on hormones. Women, we have our progesterone, we
Yeah.
have our
Estrogen.
estrogen. So those are our major hormones. And fibroids are dependent on that. So usually, when you are pregnant, you could have a fast-growing fibroid that was just laying there dormant, but now you are pregnant, so it could grow. And actually, I want to touch on this. Sometimes they grow big to an extent of even affecting fertility, depending on where they are in your uterus. So we've seen people also losing their pregnancy early because of the size or bigger size in their womb that caused that in what is it the loss of that pregnancy. Or sometimes we just leave it alone, it grows with the pregnancy, it doesn't necessarily grow too big to be removed. So that's one factor, depends on the size, Don. And of course, if it's small enough and maybe it's causing a lot of bleeding, your gynecologist or myself, I could put in maybe an IUD. There's a little guy that we put in there, it's like a T-shaped, which has progesterone, which could actually help with maybe slowing down that bleeding. So it depends really on the size, and also the discussion you have with your doctor, what size, what options you have there. And of course, myomectomy, which means the removal of these uterine fibroids, more especially when you are in that age, childbearing age, and there's maybe a possibility that they could grow before you even start your family. And of course, again, depends on the size. So a gynecologist could just remove them so that they don't interfere with your future pregnancies. So it depends. And of course, there's other pills, that we would give. So it honestly depends on the size, Don, and of course, what's available for you. Some countries, they just do a conservative way of looking and watching them, saying, okay, we're gonna do ultrasound, pelvic ultrasound every maybe a year, sometimes 6 months to a year, and just to keep an eye on that. And of course, depending on the symptomatology, I mentioned some people they bleed a lot, right? I've seen women actually even in their menopause years, Don. I had a patient who had a very tiny that was bothering her. It was bleeding. We couldn't believe it. And we tried the route of medication. It just didn't work for her. So she had to go for surgery. So each person is different.
Hmm.
I don't usually encourage women to say, oh, okay, you have the same size, or maybe you have the same symptoms. You watch and see with your friend. Just talk to your doctor, have a discussion that you understand so that you can have a plan that is mostly for you. It's
Right.
tailored for you, right? We don't use a general, basically, approach.
Yeah. And I mean, a little bit about that also affects the type of relationship and your partner,
Yeah.
and where you are in, I'm going to call it your reproductive phase,
Yes,
right?
yes. Like I said, actually, I had a very sad situation one time. This lady who was going through maybe 4 years of infertility, and for some reason I don't know. This was back in South Africa. For some reason I don't know why she was never sent for a pelvic ultrasound. And by the time I checked, she had, like I said, like 4 weeks. I mean 4 months sized uterine fibroid. And at that time, it was too late. The only option she was given is to remove the whole uterus, right? So, screening. If you find that you have some pressure, you are uncomfortable, just go see a doctor. Simple, non-painful test, pelvic ultrasound. It
Yeah,
can tell, right? So honestly, it could affect. And I mean, we've seen fibroids, sometimes spouses not understanding. Like I said, there's a lot of cultural component, and also the myths that are out there. And some women, they hide it because they've seen maybe a friend who lost their relationship.
right.
So we need to also educate. And a lot of times, actually, Don, when I have my patient with a result, I usually say, do you want to bring in your spouse or your partner so that I can also educate him, right?
Right.
I
Right.
think that's the best approach, because they need to also understand, because people start Googling too, right?
Yeah.
Also, it could just change the dynamic of a relationship, and it was not meant to go that direction. So we also want to educate the spouses.
And since we're talking about spouses and treatment planning, let's talk about this whole issue of vaginal health and some of the things that are recommended. I know you talk about pap smears and other things. Let's talk about this whole, you know, treatment planning framework. What are things that our women should be thinking about and doing, right, as part, as part of their vaginal health, right? Whether them having sex or not.
Right. The key thing though, women need to keep clean. That's basic thing. It's just as basic as it is. You need to watch your hygiene, right? And I mean, there's a lot of dermatological tested um, liquids we would recommend. Things like Vagisil, that comes to my mind. We do recommend that. It keeps your pH down there very clean and very neutral, like it's the pH that is acceptable. And not to use all the douching, the douching that people use. And the other thing I need to mention is, I tend to see a lot of women, more especially uh, from the African continent, using the antibiotic Flagyl. I don't know where it came from, Dawn. Women love Flagyl. They say, I'm cleaning, doc. I'm cleaning my womb. And the sad part is, it's an antibiotic, right? And the same antibiotic, you could actually get yourself even resistant to antibiotics because of misusing this. Because we do not give antibiotics over the counter. So some people, like some countries, I know in West Africa, people, they have access to antibiotics, right? They go to the market and buy it. So there's also that element. So now you start having all this discharge from yeast infection from something you were not even supposed to do, because you were cleaning your vagina. So that's number one. No self medication. Keep your hygiene just as simple. And also, like I said, if you love being on the pool or hot tubs, actually hot tubs could also predispose women to the bacterial vaginosis. Spend maybe 15-20 minutes and go out, and not to spend too long, too much time inside hot tubs or on the lakes, because that could also predispose you to the BV, the bacterial vaginosis. And also the importance of using condoms. People, they tend to underestimate that. Sexually transmitted infections, they occur even in relationships that are, people thinking they have stable, I have 10-year relationship, or I'm married. And if your spouse, your partner is cheating on you, I'm not going to tell you to leave that partner, but prevent yourself from all of these things. Use of condoms, right? Because unfortunately, it's not only just the stuff that I've mentioned, the gonorrhea, the chlamydia. There's also HIV out there. There's also herpes out there. So it's important for women to pay attention to that, because I've seen some women telling me that I'm married, but then if your spouse is cheating on you, then you need to make a decision for your health, right? Use of condoms. So that's very important. And just that avoiding self medication, Don. And also the importance of watching those symptoms. When you see them, go see your doctor immediately. because a lot of times people are held back by fear. So you have even mothers. I want to talk about that old population, the postmenopause women. You know how that age, there's a lot of stigma. They don't want to be touched down there. There's a lot of that, right? Our mothers, our grandparents. But
Yeah.
it's important. Like a lot of times, again, cervical cancer tends to be, we tend to diagnose it late in black women because they
Right.
don't come for screening. So even for older women, and again, it is due to an HPV, which is human papillomavirus, which is an STD. I mean,
Right.
which is an STI. So screening, screening, screening. We screen for pap smear till the age of 69.
Right.
Yeah.
Isn't some of this cultural though? And you used the word myth earlier, so I want to go down that road, as we get close to the end. How does culture affect some of this? You just talk about the older women, for example, right?
Wow.
Who, as far as some of them is concerned, the vagina isn't as busy anymore because I'm not having sex and I'm not having kids, right? So my focus is not what it should be, right? Or for those who are in their, heightened years, if we want to use that term, they don't see certain things as practical because of how culture plays in our minds, right?
Yes, yes. You know what, Don? Sex is sex. You know what? And if I always say, whatever you did when you were 30, it catches up with you when you're 60 and 65. So when our grandparents or tell you that, you know what, I'm not active anymore. But if you were at some point, if any woman who is sexually active is at a risk of HPV, which is the human papillomavirus. And here's the interesting thing, you don't even know sometimes you had it. It's like flu sometimes. Some women will clear it, some will not necessarily have any symptoms like genital warts or cervical cancer. So women, they need to know this. For as long as you are sexually active, you are at risk of these things. Like I said, if you're not using condoms and you have a partner that cheats on you, or that had maybe an untreated sexually transmitted infection that could basically affect you. So these are the things that are important, that people not use age, because I have actually diagnosed sexually transmitted infections in older women. So sometimes because they don't necessarily screen, sometimes maybe someone now is widowed, has never really checked, or maybe quit maybe having sexual intercourse 10 years ago, and has had that discharge sitting there without necessarily showing any symptoms. Some people, they would have a genital what, they would like, I'm not sexually active, but maybe it's something she caught maybe 10, 15 years ago, right? So the key thing is, it's us to have these conversations, normalize them. For as long as you are a woman, you are sexually active at some point in your life, you have to do these pelvic examinations, your vaginal health, till you're aged 69, at least to screen for pap smear, like I said. And of course, beyond that time, Don, we do see women who are bleeding. Any bleeding that occurs after 1 year of no period. Because when we say you are menopausal, we say you have no period after, like a period that appears after 1 year of nothing. So that bleeding is abnormal till proven otherwise. I mean, it could be dryness from atrophy. Like, I mean, women's vagina dries up with time as you age, right? So that could probably from friction, maybe when you have sexual intercourse, or even without, you could have a little bleeding there. So that again, we have to send you for further investigation. Sometimes we need to do some biopsies there to take
Right.
little piece, right? So it depends really. So the key thing is, there's no age in this. If you know you are sexually active at some point, encourage your mother, your grandmother, to go for pap smear.
Yeah.
Because we see people at the end where they have a stage 4 of cervical cancer, and this is 100% preventable.
Yeah. But isn't that again, like I said, part of this whole culture? Because there's this thought that sexual activity stops after a certain age, and we would never imagine that people at certain age are still, active. I remember having a conversation with somebody who says the people in some of these nursing homes and these senior care homes are so busy sexually, you'd be amazed, right?
Yes.
Because people still have those desires and they still act on it, and therefore here comes the risk. So having those conversations, even with parents and older members of our families, should be norm.
Yes, you know what? Actually, Don, we do see even sexually transmitted infections at the old age homes. We do. So people are sexually active. So we need to normalize these conversations. Sex has no age when it comes to that stage of you are done, and people should not shy away from it because it's beautiful. It was designed for that. And if you still have desires or wanting to do it, there's nothing wrong with that. But the key thing is doing it responsibly with the person that you are responsible with. But there is no cut of age.
Yeah,
No
at
cut
least
of age.
none that established, especially black people. They keep going forever, it seems, some of them,
Right, right, yes,
which is good. We want to close the show by talking a little bit about some of the myths,
yes.
right? You mentioned that word earlier. What are some of the myths that we need to clear up as we kind of get to wrap up?
Right, yes. I mean, the myths that the fertility part, people thinking that when you've had fibroids, you'll never be fertile. That's not true. Like I said, it depends on the size. It's always important it's not an absolute that when you've had fibroids, you'll never have children. So that's a myth, right? And the fact that people don't believe when they see these symptoms, they believe that no, it's not. Or maybe sometimes people believe that they are bewitched, Dawn. We've seen people thinking that someone is bewitching me in Africa,
Yeah, yeah, that's true.
in Canada.
Yeah.
There's a lot of those things, and this is mere a gynecological issue that we can actually solve. So those are the most common ones that we see people believing that there's no hope after. So that's why I'm saying it's always important to bring those spouses to understand and be educated on fibroids. And of course, just the whole thing that if you are not sexually active after you have had history, you cannot have an abnormal pap smear. That is not true. So screening for women who are sexually active till the age 69 and just following up,
Yeah.
right? Yes.
Yeah, so I hope people who are watching take some of these key lessons away. Screen, go and have a checkup. Ladies, do the pap smears and the other things that are a part of that routine of getting information and understanding what is happening. Uh, Understand that vaginal health is a part of what you should do, right? It's not only there for sex. There are lots of other things happening down there that you need to be aware of. And like you said, Doc, the things that you possibly do 30 years, 20 years ago, at some point, still has some impact down the road, right?
Yes.
So
Yes.
be conscious of that. Uh, what's the parting lesson that we want to leave with those who are watching? There's one thing, because we say a lot of things today, and I usually understand that people hear and it slides through and they forget. But if
Yes.
there's one thing you want, especially the women watching,
Yes.
to take away, what would that one thing be?
You just said it, Don. Screening. I love women when they come to my clinic for screening. Pap smear is one of my favorites because it's 100% preventable, Don. So screening. It's free. You just go in there. It's less than 5 minutes. We're done. That's very important. And of course, the importance of following up. Some people, they would know they had an abnormal pap smear, but they never follow up. They think it's gonna go away, and they start going back home and say, you know what, I'm gonna go for my traditional medicine. I'm gonna do all these things, and then by the time they come back, it's in the later stage.
Yeah,
So screening, and also just asking those questions. There's no stupid question. Ask your doctor if you don't understand, and if you see any abnormal discharge or something new you are observing, you have something that's unusual, go immediately. Don't
yeah,
stay and be scared. Doctors are there, they are trained to help you and basically direct you to the right direction. And we do these tests.
yeah.
You know, yeah,
Don't continue. Don't feel like, okay, because I'm in a relationship or a sexual relationship, I need to continue. So even though this is happening and there's discomfort and all the rest of it, you
yes,
figure there's an obligation to continue.
yes.
Go and have it checked.
Yes. And also maybe to add on spouses to be supportive, to be supportive.
Right.
Fibroids is not the end of the world. It's not the end of the world. And unfortunately, if your spouse or your wife has to unfortunately go through hysterectomy because of the biggest fibroid she had, there's options of adoption. Black people have been adopting forever informally. We've been
Right.
adopting our sisters' kids.
Oh
So
yeah.
what
Yeah.
stops you? Right?
Yeah.
What
Yeah.
stops you if you could do it? So that's also an option.
Right. Right. Awesome. This was great, Dr. Yanati. Always a pleasure to to have you on, and we touch base on different levels outside. I appreciate the time as always.
Thank you so much, Don. Good luck.
All
Thanks for
right,
inviting me.
all right, take care.
Take
Awesome discussion again, folks. We went through June talking about health issues. We started talking about cancer. We talk about diabetes. We talk about natural options. And today we looked at some of those things that affect our females. Fibroids, vaginal discharges, other things around the reproductive system. And I hope over this month you have learned a thing or two. Right? You've gathered some information because that's what we want Wataguan to be about. In July, we're going to get into a different theme. We're going to talk about stories, stories that people have shared. And many of the guests that we're bringing on in July have written books and have shared their stories. Next week, July 2, we're going to have Grace on. She's going to talk about Dare to Dream because dreams come true. The following week, we're going to have Stacey Ann Smith. She's going to talk about why she wrote a book called Time Does Not Heal. And the following week, we're going to have Andre Smith come on, my brother from Jamaica, talking about beyond the walls of the ghetto, right? Sharing their stories with us and hopefully to inspire, who knows, one of us onto greater things. That's what July is going to be about. For those who joined Wataguan late, the patois phrase was Tansabak, right? Hopefully, I get some people putting the responses in the comment section about that. Tomorrow, we're going to have our general meeting on Zoom. Jump on our website, get the login information, come on and join the conversation. And July 10th, help us spread the word. We're going to have Little Taste. Jump on our website and put your order in. And then at 6 o'clock, we're going to have our cultural showcase virtually. Lots of great artists. You don't want to miss our first ever virtual cultural showcase. Thanks as always for joining Wataguan. If you haven't liked our page yet, please like it. If you have not subscribed to our YouTube channel, please jump on it and like it as well, or subscribe to it. And next week, we're going to do it again, right? As always. Calgary is going to be hot this weekend into next week. I think all of Canada is going to have a heat wave. I'm talking mid 30 degrees Celsius. So for everybody, take it easy. Andrea, Glenn, Maya, everybody who jump on, big up and take care until next week. All right? Well, good.
I'll make to the corner with a make it. And that's where they make the take it. So